Today we're going to be talking about the axial skeleton. We're going to start with the cranial. The frontal is located here. Parietal is here. And if we turn him around here, like so, we are able to see the occipital area. Here is the external occipital protuberance, and this area is important because you have some muscles that are located here in the origin of the trapezium, which give us the ability to tilt or move our head forward and backwards. Next, we are going to take a look at the temporal, which is right here in this area. And we're going to take a look at a few more places externally. Alrighty. Also in this area, you have the temporomandibular joint, which is right here in this area here. You have the mastoid, which is located here. And the styloid, which is hanging right here in this area. Next, you have the external acoustic medius, which is located here. This is where we receive our hearing. And lastly, in this area, what I'm going to show you, we have the squamous part here in this area. Alrighty, if we take a look on the interior of the cranial, we will take a look, open him up here. Take a look at a few more things. And the first thing that we're going to take a look at is the petrous. The petrous is located here on the temporal bone. And the temporal bone is important because this is where the temporal muscles and the temporal fascia are located. Next, we are going to talk about the internal acoustic medius, which are these two little holes here. And these are important because at the other end of this, you have your eardrum. Still internally, we're going to take a look at the sphenoid or the sphenoid. This is the lesser wing of the interior of the sphenoid or sphenoid. This is the greater wing. And as you can see, they both look like two little wings, and it's just a jump from the lesser to the greater. The optical canal, which is right here. And the sella trocea, which is right here in this area. And let's talk about these areas for a little bit. The optical canal or optic canal is a short canal through the lesser wing of the sphenoid at the eye socket. The optic nerves and the ophthalmic arteries pass through here. So it's really important to have and look at those optic canals. Next, the sella tertia or sella turcica. It's a fossa area in the sphenoid bone where the pituitary gland is housed. So again, you want to take a look at the optic canal as well as the sella turcica. Both these areas are very important. Alrighty, next we're going to jump back out of the cranial and we're going to take a look at the superior orbital fissure. So we're going to turn them back around here. Move the camera back a little bit. If we tilt his head up here, the supraorbital fissure are the areas here. You see me poking here, and it runs through the eye. So those are the areas of the superior optical fissures, and they're the slits in the posterior wall of the orbit. This is the main area that things get brought to the brain through the orbit. Here you're going to see muscles, glands, mucosa, skin, and all of these will need to receive the nerve fibers from the cranial nerves, which have to go through the orbital fissures. The optic and the rectal do not apply to this area, so they're not in this area. Alrighty, so the next thing that we're going to look at is the ethmoid internal view. So we'll go right back up to the interior, and we're going to start with the crista galli. And I actually like the name. I'm not sure if you do, but the crista galli is right here of the ethmoid bone. And the next area that we're going to look at is the cerebriform plate. Now, the reason that we're looking at this area is because the crista galli is where it's a median ridge, and it's where the olfactor sits on either side on top of the cristiform. But you're also going to see, because of the crista galli, you're going to see the flax cerebri. It's attached to the anteriorly. It's attached anteriorly to the crista galli. So that's why that's important. The next one that we're going to see in the same area